What was going to the doctor like in the Old West? The Old West wasn't just about cowboys, saloons, and gunfights. Pioneers living on the American frontier also trusted doctors with all kinds of treatments. Epidemics, accidents, and venereal diseases kept doctors busy. But unfortunately for the patients, most border doctors did not have a medical degree. In the Wild West, anyone could pose as a doctor and promote cures such as drinking sulfur or leeches. The border was a dangerous place. Rich Bar, California, a booming gold rush town, attracted 29 doctors who were constantly busy. One doctor's wife wrote, "In the short space of 24 days we had several murders, terrible accidents, assaults, whippings, and expletive duels. Sometimes medical treatments were more dangerous than the diseases they treated." Frontier doctors prescribed a mercury compound that caused people's teeth to fall out. They did the operation without anesthesia. One doctor recommended treating patients with neck bleeding. So it is not surprising that some pioneers argued that frontier doctors were doing the devil's work. Untrained frontier doctors performed experimental procedures. Doctors of the Wild West practiced medicine without formal degrees, and some doctors had no formal training at all. The lack of medical personnel on the frontier allowed self-taught healers to practice avant-garde medicine. For example, in 1827, a former warden performed the first successful cesarean section in the West. John Richmond worked as a janitor in a medical school, where he listened to lectures. He called himself a doctor and performed a cesarean section without ever having seen one before. Richmond wrote, "I found that whatever was done must be done soon, and feeling a deep and solemn responsibility, and possessing only an ordinary pocket pill, I began the cesarean section about 1 o'clock in the morning." The patient never complained of pain during the entire period of treatment. Successful in this case is a relative term, and Richmond's description of the procedure was discussed. Although the mother survived the procedure, the baby did not, and author Jacqueline Wolfe wrote that the patient begged Richmond to end the pain in Wolfe's book, Caesarean Section, An American History of Risk, Technology, and Consequence. Bleed, blister, and purge was the mantra of many early pioneer doctors. Even trained doctors relied on dangerous treatments in the 19th century. Dr. Daniel Drake, a founder of Ohio's first medical college, strongly advised bleeding for patients whose pulse is nearly imperceptible. If the doctor's lancet couldn't induce blood flow from a vein, Dr. Drake recommended cutting the jugular. Blister treatments involve peeling off patients' skin to rub on irritants. Some doctors even wrap cotton around their patient's skin to burn it away, an intensely painful treatment. Most of the treatments patients received from their doctors were narcotics or purgatives. Frontier treatments were sometimes more dangerous than the disease. Doctors treated many conditions with purgatives, meant to clean out the patient's system. They commonly administered massive doses of ipecac to induce vomiting. Even worse was calomel, a mercury compound so strong that it weakened patients' gums and caused their teeth to fall out. By the 1840s, frontier doctors began administering quinine, an effective and safe substance. However, it remained extremely expensive. A single ounce of quinine could cost more than a fattened cow. Superstitious people often accused doctors of doing the work of the devil. Doctors performed autopsies, declared themselves famous law enforcement after ammunition expired, and sometimes had to perform unusual operations to save patients' lives. One frontiersman wrote, "I cut the throat of a child suffocating with diphtheria, opened the trachea, and held it open with hooks." Superstitious people once believed that doctors were doing the work of the devil. In one case, the doctor performed the operation on a Sunday morning. His patient, who suffered from a large ovarian tumor, was operated on without anesthesia. A crowd gathered at the doctor's office, announcing that the doctor was killing a woman. The superstitious crowd did not stop the surgeon. His patient survived a 25-minute procedure that removed a 22-pound tumor from her abdomen. Doctors fought to the end over their territory. Doctors looked different on the border. In emerging cities, doctors set up their offices wherever possible. Dr. George Goodfellow established his first office at the Golden Eagle Brewing Company in Tombstone. After a fire destroyed the building, Dr. Goodfellow moved his office to the Crystal Palace Hall, the same building that housed the office of Deputy United States Marshal Virgil Earp. Frontier doctors defended their territory. When Dr. Edward Willis moved to Hangtown, the town's only non-medical doctor challenged Dr. Willis to a duel. The risky move did not pay off for the uneducated doctor, who lost the duel and his life. Doctors without institutional training embrace different and sometimes wild theories of medicine. Anyone could hang a shingle on the border and call themselves a doctor. As a result, untrained doctors could promote strange treatments that were often harmful. Doctors can prescribe secret Native American herbs or strange diets to treat all kinds of ailments. Others suggested a bath as a treatment. Many advocated removing bad blood from sick patients, often through bleeding or leeching. Many pioneers believed that the most effective drugs tasted the most disgusting. That is why some doctors recommended drinking sulfur to treat diseases. Many patients feared doctors almost as much as they feared illness and disease. A visit to the doctor could mean the end of you in the Wild West. For example, consider one doctor's treatment of malaria. Then take the patient into the corridor between the two booths, take off all his clothes so that he lies in the cold air and naked on the sack, and then and there pour over him successive buckets of cold spring water and continue until he has a decided and quite powerful wise opportunity to shake. When the patient's tremors became too great, the doctor gave opium. Another doctor recommended patients who had bleeding from the neck, which almost certainly had a high mortality rate. It turns out that Dr. Quinn wasn't the only doctor in the West. In fact, the Old West really offered new opportunities for women. In 1880, Dr. Bethania Owens Adair earned her M.D. from the University of Michigan Medical School. He moved to Oregon, where he practiced medicine in Portland and Astoria. As Dr. Owens Adair described, practicing medicine in the West was a major challenge. I did my professional work to the best of my ability in this remote place, and I never turned down a single invitation, day or night, rain or shine. Often I was obliged to go on foot, through paths so densely covered with undergrowth and blocked up with logs and roots that horse and rider could not pass, and through muddy and flooded tidal flats in rubber boots. Until the 1860s, few frontier doctors had professional degrees. Most Western doctors did not have a medical degree. In 1880, Tombstone had a population of 2,012 doctors cared for the residents. However, 8 doctors did not have a medical license. In fact, most frontiersmen had no formal medical knowledge or training until at least the 1860s. According to one researcher, more than 25% of doctors in the border region did not graduate from medical school. As a result, medical treatments have ranged from the latest medical advances to completely invented treatments. Doctors charged about 25 cents to $1 per visit, but most patients paid in goods or services. Many physicians also served as druggists, making their own medicines. Frontier doctors didn't just treat patients. They also often made and sold their own medicines. In some towns of the Old West, the doctor also served as a pharmacy clerk, since there were no qualified specialists in the community. Apothecaries often stocked leeches that doctors used to bleed patients. Narcotics also mixed their own medicines from raw herbs, leaves, and roots. Doctors James Robinson and Ella Ford met in medical school. After they both received their degrees in 1878, they moved to Jacksonville, Oregon, where they opened a pharmacy with their own medical offices. Unfortunately, Ella was born just a year after the couple set up the practice. Doctors often traveled long distances and through rough terrain to see their patients. Doctors traveled long distances to see patients. Dr. Forbes Barclay, a Scottish immigrant, traveled through Oregon and Washington to treat patients, traveling on horseback and sometimes hiring a Native American guide to take him by canoe. When doctors arrived at the scene of the accident, they often performed emergency surgery on the spot. One surgeon described operating on a patient lying on a whiskey barrel while the doctor sat on a stump. The surgeon used one hand to operate and the other to swat away flies.